viewers, you're watching The Savera and I'm Vidhi Joshi. The Supreme Court has issued a significant directive mandating the removal of all stray dogs from public spaces across Delhi-NCR within 8 weeks. The order requires municipal bodies and related agencies to work in coordination to establish dedicated dog shelters across the city, ensuring that once stray dogs are housed in these shelters, they are not released back onto the streets. This intervention comes after the Apex Court took suo motu cognizance of a report highlighting rising dog bite incidents, many of which have resulted in rabies cases. The court observed that hundreds of such incidents are being reported daily in the capital and its outskirts, with children and the elderly being particularly vulnerable to the fatal consequences of rabies. In response to the growing crisis, the Municipal Corporation of Delhi has taken several steps to address the stray dog issue. The corporation recently announced plans to upgrade its animal birth control centers and initiate zone-wise anti-rabies awareness campaigns. These centers, which function in partnership with NGOs, will soon begin implanting microchips in stray dogs to record their sterilization status and other vital health details. In addition to sterilization, the facilities will conduct routine health checks, including blood tests. As part of a broader effort to tackle the issue, the MCD plans to establish 12 dog shelters, one in each of the city's zones. These shelters are intended to serve as safe havens for stray dogs, offering medical treatment and the possibility of adoption, while also removing them from public areas. Despite the city's estimated stray dog population of nearly 10 lakh, there are currently no dedicated shelter homes. The newly proposed shelters are expected to fill this critical gap. Rajpal Singh, a member of the MCD Standing Committee, confirmed that the policy to establish these shelters and manage the stray dog population was unanimously approved by both political and executive wings. He noted that although NGOs claim to have sterilized 65% of stray dogs, actual figures are believed to be closer to 30 to 35%. The MCD currently spends around Rs 1.20 crore annually on sterilization with little visible impact. The policy also calls for the active involvement of municipal officials, elected representatives, resident welfare associations and social organizations. All stakeholders have reportedly agreed on the necessity of coordinated action, and the public is expected to begin seeing tangible outcomes soon. Standing Committee Chairperson Satya Sharma said that while the proposal is in its initial stages, a dedicated committee will be formed to materialize the plan with the ultimate goal of achieving 100% sterilization of the city's stray dog population. Meanwhile, the Delhi government is exploring legal options to relocate stray dogs considered dangerous. Currently, the Animal Birth Control Rules 2023, framed under the Prevention of Cruelty to Animals Act 1960, prohibit the relocation of stray dogs. These rules mandate sterilization, vaccination and return to the original location. However, a high-level meeting held at the Delhi Secretariat discussed the possibility of seeking amendments to these laws to allow for the permanent relocation of aggressive or habitually biting dogs to shelters. It was suggested that such dogs be monitored and rehabilitated under expert supervision and potentially returned to their original locations only if their behavior improves. Delhi Chief Minister Rekha Gupta reportedly emphasized that this issue must not be treated merely as an administrative task, but as a social responsibility. She stressed the need for a human and comprehensive approach, advocating for the inclusion of animal welfare groups, experts and concerned citizens in the policy-making process. The government is also working on creating a platform that brings together residents and animal caregivers to formulate long-term solutions that protect both people and animals. Official MCD data reveals that between January and July this year, 49 rabies cases were reported in Delhi, and over 35,000 animal bite incidents occurred in just the first 6 months. During the same period, around 65,000 street dogs were sterilized and vaccinated. There are currently 20 sterilization centers operating under NGO management, which perform surgical sterilization and administer anti-rabies vaccinations. However, the ABC rules continue to require that these dogs be returned to the locations they were taken from. In an effort to boost results, the MCD Standing Committee recently formed a subcommittee dedicated solely to managing street dogs. This panel has decided to re-engage current NGOs and bring in additional organizations to accelerate sterilization efforts. An intensive month-long sterilization drive is also being planned to further curb the stray dog population. These latest initiatives comes at a time when public anxiety over drug bite incidents is escalating across various localities. Maneka Gandhi, BJP leader and long-time animal rights advocate, participated in recent discussion and emphasized the need for well-equipped birth control centers, trained staff, modern medical facilities and robust monitoring systems. She called for long-term planning in partnership with NGOs, welfare groups and local communities to ensure human and effective solutions. While legal constraints remain, the coordinated efforts between the judiciary, municipal bodies and the state government signal a serious and multifaceted attempt to resolve the stray dog issue in Delhi. With the Supreme Court's strict timeline and the MCD's policy momentum, the coming weeks will be critical in shaping the future of stray animal management in the capital. That's all for now. Stay tuned to the Savera for more updates. Do like, comment and subscribe to the channel.